I became a nurse because basically when I was a kid, I had a really good friend. His mother was a nurse. She was by far probably the kindest person I've ever met. And she was a nurse herself. And it just struck me. I was like, she's always happy. And I said, you know what, I think I want to be like her. As I got older, you know, I mentioned to her my desire to go into the medical field. And so she encouraged nursing. So when I got out of high school, I had to make a decision, and I decided to go the nursing route.
For me personally, I was excited about the existence of the human body. I had a 6th grade teacher who was teaching us health and taught us where to find the pulse points. And from that point on, I was walking around checking my pulses all the time. From the moment on that I became excited about the existence of the human body and being able to learn more about it, I got into nursing school and got more excited about it, but nothing compares to the excitement of the day that I got to care for my first patient.
In high school, I was in a health science class at the Career and Technical Center, and I got to shadow a nurse here at this hospital. That's the time I was really trying to decide whether I wanted to do nursing or something else in the medical field, and I just really loved what I saw with her, with that nurse.
But I always knew in the back of my mind I was supposed to be a nurse. From a child, I was supposed to be a nurse. And I just kind of ran from it until I saw my grandma in the hospital, and I saw the nurses, and I saw the compassion that they had and the caring, and I knew I could do it, and I knew I could do a good job of doing it. And I decided I would go back and be a nurse, and that's what I did.
I was out of high school, and at the age of 18, I knew I wanted to help people, and I didn't really know in what capacity though. So I had looked at several different fields. I looked at becoming a social worker, a counselor. I always said that I would never be a nurse, but then I found myself really praying and talking to God about it, and He led me to nursing. It's just a satisfaction thing. It makes me feel like I have a place in the world and that I belong. And I wanted to bless other people, but nursing turned out to become more of a blessing to me.
I didn't set out to be a nurse. I actually set out to be a respiratory therapist. But in that profession, I gained such knowledge and admiration for my coworkers. And I saw the love and respect and the compassion that they gave. And that fit me because I'm a compassionate person, and I love my patients. And so I decided to continue on and get my nursing with encouragement from my coworkers. Never regretted a day. It is the most fulfilling profession that anybody could want to do.
When I was about 8 years old, my grandmother came down with breast cancer, or was diagnosed with breast cancer. She raised me and my 2 siblings. I remembered helping do the bandages at home once we got home. But what I did remember was the nurses. And she recovered okay. Several years later, the cancer did come back, and we had hospice at home with her. And I knew then that I wanted to be a nurse. I wanted to do what they did.
My mom was Ann Gilley, and she was an LPN for about 30 years before she passed away. So we have 3 generations of nurses in our family. I felt early on in life that I wanted to be a nurse. I can't pinpoint one event in my life that made me choose nursing other than the fact that I've always loved people. I love talking to people.
Which is actually pretty funny. When I was in about pre-K, we had a little career day. So we dressed up for the career we wanted to be in. I actually chose nursing because one, I had a heart for missions, and I loved helping people, and I thought the best way that I could really preach the gospel and show them more so the gospel and to help them is through nursing.
Initially, I thought I was actually going to be a school teacher. I would always gather kids, get them together, play school with them. But I've always been a caring person. My mom would always tell me, well, Jessica, you have a old spirit about yourself. You're always trying to help people. I actually took a course in high school. I think it was Nursing Allied. Went over there, they start showing us the basics, things you do with nursing. And I remember going home, I said, Mom, I think I like that. I said, I actually love helping people. So after I graduated, I went right on into LPN school. And from LPN school, I worked maybe about a year. Then I went on in and got my RN.
I got into nursing because I felt like it was a calling on my life. For me, it's more than just a job. It's an opportunity for me to serve those who otherwise are in a position where they can't serve themselves. I enjoy nursing because it gives me the opportunity to work with a great team of doctors and nurses, and I enjoy providing compassionate, kind, quality care to patients and their loved ones.
So initially, I think that whenever I knew that you could be a nurse and really have some good job security, that's what drew me to being a nurse at the time. And then I didn't realize that we would end up having to take care of our grandpa. He ended up having lung cancer and a brain tumor. That's the point where you know that these people don't want you in their most intimate areas, or helping them in these most intimate times. Like, you really are the ones that they just need. I just feel like that's one of the things that made me realize I was going to be a nurse. And it makes me sad because I hate that he had to go through that, but he really inspired us to be the people that we are.
These people don't want to be in these situations. Half the time it's not a very happy reason for them being in the hospital, which is why we have to show compassion to them and turn around and do the things that we do and not be judgmental and make them feel comfortable. Even if we are uncomfortable, you can't show that to them, because that is the reason why we're here.
I became a nurse because of a health occupations class that I took at Headland High School. I took that class in '95, and I came here to do clinicals. I did my clinicals on 4 East. I was very impressed. The nurses that worked together as a team, they took care of patients. I got to follow them around.
This is a second career for me. My son was graduating high school, was joining the Army, and I felt like I needed something to do. So I decided that I would go to nursing school. I had a great career. I worked in neurodiagnostic testing. I loved what I did. I had no desire to be a nurse, even after I graduated. And then the first day of clinicals, we went to a nursing home, and my patient was not able to speak. She couldn't feed herself. She was contracted, and it was important to me to try to maintain her dignity as much as I could, because she was still there in her mind. She just couldn't speak. And after that, I just knew that's what I wanted to do.
Most every days that I came to work, I would thank God for giving me the opportunity to be a nurse and to be able to have the experience of making a difference in someone's lives. And so I still feel that, and I think that being a nurse, you have to have that feeling. Otherwise, this is a very difficult job.
If you go into nursing because of the paycheck or because it's a readily available job position, then you won't be in it for long, and you're doing it for the wrong reasons. You really have to have that calling, and you really have to have the passion to help people.
If you're in it for the money, number one, you're going to just be doing a job. And there are certain things you can go to and do a job if you're just maybe doing factory work, but when you're coming in and you're dealing with people's lives, it can't just be a job. You have to genuinely care. When I come in and I take care of a patient, I look at them, is this my mother? Is this my grandmother? That's the way I view things, because that's how I would want to be taken care of. I want you to take care of my loved one. I don't want you to have to, because this person's got to come from up under us at some point, and they need to know how to move and move the right way.
I would encourage you to come work here if you love being a nurse. Don't do it for the money. Do it because you're going to be dedicated. Do it because you're going to prioritize. Do it because you care about the patients, the main thing.
I found out in the past 12 years that a lot of times people want you just to hear them out and listen to them. And even if they're hurting or they're going through a rough time, slowing down and making time for them and letting them talk to you, letting them tell you what's going on, and then you can sort through.
One of the things I like about nursing the most is to talk to my patients, to hear the stories. I always say, well, how did you meet? They'll talk about their husband. I say, how did you meet? I love to hear their stories. I love to care for people. I love to make their life just a little bit easier. So that's why I love nursing.